I wanna make sweet love again. No, I wanna be the one feeling low. Never let you go, no.
All the way from 1987 from the album The Big Throwdown, Levert with Casanova here on Breakfast in Bed on Smooth 98.1. Love music, love life. It's about time for the soul food conversation, which means bring all your notes out and take notes, or your rather your book and your pen, whatever it is that you like to jot things down. You know what I mean? Jot things down. And it's about to be very interesting. But first, go to our YouTube channel to see my face and that of my guest. Yes, I am mandating you to do that. www.youtube.com/smooth91fm Lagos. Smooth 91 FM Lagos. Our WhatsApp line is 0809 Twitter is at smooth 91 FM. Hashtag breakfast in bed 981. She is no stranger to this show. You have heard her voice many times. She is an international board certified lifestyle medicine physician altogether. She's a doctor. When it concerns weight loss, you'll find her there. I am talking about the one and the only Dr. Chinasa Amadi. Good morning. You are
Good
muted.
morning.
Aha, there we go. How are you doing this morning? Aside glowing, of course.
I'm good. How are you? Thank you so much for having me again here today.
It's a pleasure. You know how people on Instagram says, I woke up like this. So yeah, you just
You
literally woke up like this
know,
and you're glowing.
it's not my fault.
Yeah, I know. Okay, so we are talking about hepatitis this morning. That is the conversation, just an overview because hepatitis is quite a broad topic, but we are talking about it in the regards of you preventing anything that can harm your liver because that organ, even though it can be quite forgiving, it regenerates itself, but you need to pay more attention. So we might focus on the prevention and of course maybe the treatment and some other information for you on the topic of hepatitis. You know, you can always send your WhatsApp messages to 0809 So doctor, let's go right into it. Let's even define hepatitis because that's usually the best way to start. What is hepatitis?
So let me just, like the way we're taught in medical school, when you hear itis after a parent word, that means it's an inflammation of that thing. So hepa is pretty much liver. Then the itis is like inflammation of the liver. So basically, in one short sentence, hepatitis is inflammation of the liver. Now, inflammation of the liver could be anything from both infectious causes. It could be caused by infection. It could be caused by long use alcohol. It could be caused by drug. It could be drug induced. It could be toxic induced. So anything that causes that organ, the liver, to start working against itself, that's it's like it is not working as it should be, then it can cause, that's a cause of hepatitis pretty much.
Okay,
And
so let's
inflammation of the liver.
thank you for the extra information. Now I know that anything that has titis at the back, it is inflammation. So skin titis is inflammation of the skin. No, there is nothing like that.
So you can say dermatitis. You know, derma is the core parent
skin.
word of skin. So dermatitis, you understand? Gastritis, gastric stomach inflammation. Yeah.
Oh.
Yeah.
Oh, thank you, doctor. You go school well. Thank you. Now I know something. All right, so back to hepatitis. I don't know if there is any other condition that has such a high affinity for letters of the alphabet like hepatitis. We have A, B, C, D, E. Thank God we don't have F. So help us break down the different types.
So we have A, B, C, D, E, Epstein-Barr virus. We have alcohol-induced hepatitis. We have drug-induced hepatitis. We have toxin-induced hepatitis. So there are different kinds. However, the most common is usually the hepatitis A, B, C, and alcohol-induced hepatitis. we're beginning to see a lot of drug-induced hepatitis too. So these are the most common types, especially the ABC. Yes. Now it's important to know that, let me just quickly explain about, just differentiate them. Hepatitis A usually is caused by, there's something we call fecal oral mode of transmission. That means fecal is from like stool, poo-poo, and to the mouth. So it's an infection. Sorry, I didn't mean to sound gross, but that's pretty much the mode of transmission. So it can be from contaminated food, contaminated food products, contaminated fruits and vegetables, and someone can come down with hepatitis A. Hepatitis B and C, on the other hand, the mode of transmission is usually from bodily fluids. So anything that will cause transmission of bodily fluids. It could be use of sharp objects among infected and non-infected people, unsafe sexual practices, tattooing, piercing, all these increase risk for hepatitis B and C. And as the name implies, alcohol-induced hepatitis, this is when from long-term use of alcohol intake, chronic alcohol consumption. It's of course can damage the kidney, the liver, then the drug-induced hepatitis from use of self-medication, unprescribed drugs, use of even herbal drugs. There's this particular study that showed long-term use of herbal drugs can damage the liver too. So, and also other toxins like chemicals and from environment and stuff. So that's basically the different groups of the hepatitis, common groups.
Thank you very much. But why is the remaining, or E, I think E is not so common. Why is it not common? What's the mode of transmission?
It's not that it's not so common. It's not that it's not important, but it's not as common, as prevalent as the other group. Yeah. Sometimes D moves in association with another one. So it may not go on its own. E may not come, it may or may not be there, but usually the most common are the A, B, C, and the other ones.
All right then. So let's take the first break, and when we come back, we will be talking about the causes. Well, we've talked a bit about the causes, the symptoms, and the place of lifestyle, of course, and also vaccine, because that's also one very important one, since it has been said that it is preventable. So we will talk about the place of vaccine, lifestyle, and of course, the treatment. This is Breakfast in Bed here on Smooth 98.1.
98.1. It just feels good. Love music, love life. Hey,
so you've talked a bit about the causes, right? So causes and the mode of transmission. Yeah. Then we'll talk about the treatment options, vaccine, lifestyle practices. You've not been served breakfast. That issue of herbal product again, I think we need to run meeting again. Because last week we talked about kidney failure, and of course herbal drugs and all of that will pop up.
We're implicated. Yes. It's this concept of when there's no particular dosing, everybody just estimates what to take. Ask yourself why. You don't know what is injurious to the organ.
We live in a beautifully imperfect world of humans, the careful and the carefree. But life happens to everyone. To understand how to survive the slippery slopes of life, tune in to the AXA Mounted Safe Cruise on everything insurance that you need to know while your clock still ticks. Get the big picture? AXA Mounted Safe Cruise on Smooth 98.1. Mondays, Wednesdays, and Fridays from 6:10.
It's not just talk, it's talk about your health. This is Soul Food here on Smooth 98.1. Love music, love life. We are streaming live on YouTube, so please go there and you can drop your questions, whatever it is, in the chat box. You can also send it to 0809 444-0981. The topic is hepatitis. Things to note about hepatitis, or on the topic of hepatitis. My guest is Dr. Chinasa Amadi, and she's a lifestyle medicine physician, amongst other things. If I should give her the resume, I'll give you the resume. We will not leave this place. So before the break, she gave us a breakdown of hepatitis, what it is. She said it is an inflammation of the liver. And anywhere you hear anything titis, no, it is an inflammation of whatever comes before it. And also she mentioned hepatitis A, B, C, D, and the mode of transmission. So you should please be careful. Also in that was some of the causes of hepatitis. So let's zoom in into that, some of the causes, and then we go to the prevention, the place of vaccine and lifestyle, and of course, the one that I will want us to go further into, which we've said it many times, but we can never say it enough. That's the reduction of herbal medicines and potions.
Yeah. So risk factors for hepatitis A, like we mentioned earlier, because of its mode of transmission, lack of sanitation and unclean places, not washing food properly, eating food from contaminated vendors, eating food from, contaminated fruit sellers, contaminated vegetable sellers, vegetable food from vegetables from these vendors. That's the pretty much risk factor for hepatitis A. However, for hepatitis B, we said the mode of transmission is usually exchange of body fluid. So contact with used needles and syringes of people that are infected with hepatitis B and C, and also transmission from mother to child, during delivery. If the mother is infected, there is the risk of transmission to the child. Even children, when they are playing with each other and they have, maybe the other one has an open wound and, something like that. Or, sharing of, like a lot of drug use now, especially among youth, sharing of needles and sharp objects, that is another risk factor for transmission of hepatitis B and C. And even transfusion of unscreened blood. This is seen in cases where, emergency, who has the same blood group, and they are not, the blood group is not properly screened, and the person is infect someone, the recipient. So that's another risk factor. Also, engaging in unsafe sexual practices. There's this term that I just read about
sexual practices itself. No, go ahead. I will come back to the question.
Yeah, so unsafe sex, unsafe sex, pretty much. There's this practice of I don't know if it's called stealthing, STEALPHING, whereby, in the middle of a sexual act, the man just removes his condoms and tries to have an unsafe sex with the female partner. That exposes the female partner to hepatitis B or C. And this is pretty much common now, especially among young people. So that's another means of risk factor for infection of hepatitis B and C. And of course, indiscriminate use of sharp object, like used for tribal markings, for circumcisions, for ear piercing, tattooing. That's another risk factor. And of course, we won't forget drug-induced hepatitis, where self-medication and, taking in of toxic, like herbal supplementations or, herbal preparation. It's also a risk factor for drug-induced. And working with toxic chemicals, people that work in companies that use toxic chemicals also are at risk for developing toxic-induced hepatitis, yes? And alcohol consumption, those that consume alcohol, they are at risk for chronic, hepatitis, alcohol-induced hepatitis. So that's pretty much a summary of all the risk factors. And
very nice summary. Thank you. But I want to take you back. You mentioned unsafe sexual practices. What itself is safe sexual practices?
Unsafe sex without using protection or not?
Just that.
It's not that easy, is it?
I wouldn't know.
Because it's pretty much rampant now. It's pretty much rampant. It's beyond just people's concern most times is that, oh, I don't want to get pregnant. Oh, I don't want to have HIV. But they forget that there are other things like hepatitis B, there are other things like hepatitis C that can be there and just change the course of things.
I see. Before we go further, I think we even need to establish the function of the liver. So maybe you could shed light a bit on it. We are talking about hepatitis and how it is an inflammation of the liver. So maybe we need to even let people know why your liver is important and why you need your liver to be healthy.
The liver is pretty much it's involved is the thing that does breaking down, creating nutrient, metabolizing drugs for the rest of the body. So it's a multi-purpose. I don't know. It does a lot of things for the body. It's a detoxifying organ. Literally everything you eat, most things you eat pass through the liver. Yes, before going to other parts. So it's like that policeman, important policeman in your body. So when you take things that I'm trying to make it as plain as possible, that policeman now, you keep shooting things, bullets at the policeman, and all that's exposing it to these risk factors that we have talked about. What happens to the policeman? He becomes weak. He's not guarding as he should guard anymore. And what happens? There's the risk for either hepatitis or even a liver failure or something. Now, it's important that the liver, yes, it can regenerate, it can cut out one part, but still, it's still one major organ. Yes, it has two parts, but it's still one organ. And it's still, the love of your life will still not give you their own liver. So it is very important to protect that policeman. That's that policeman in your body. It's like your body's policeman. It breaks down, helps in metabolism. It helps in producing things for digestion. It's an amazing organ.
Going further, it seems, or at least superficially, it seems that we do not have so many cases of liver failure compared to kidney failure. Why is that?
Well, it's not, I don't think it's not that we don't have so many cases. It's just that we have not isolated the cases, because most times they are presenting late. Take, for example, like currently the recent statistics for hepatitis B alone in Nigeria is around 20 million people. But you know that this is just the number that probably that presented to the hospital, not those that didn't. So most times before one presents, most people present late to the hospital. Most people will even die and you don't know why they died. Or, the stomach was swollen, the leg was, there's always one thing and then it's, excuse
Village me. People, sorry.
Yeah.
Sorry about that. Are you good now?
Sorry. Yeah, I want to just tip up some water.
Okay. If you're joining the conversation for the first time, we are talking about hepatitis, especially as it concerns your liver, because hepatitis is an inflammation of the liver. And my guest is Dr. Chinasa Amadi. You can follow us on YouTube and see what we are about. And you can also drop your question or whatever it is there. It is youtube.com/smooth981FM Lagos. So back to what you were saying.
So it's important. It's just that we're not hearing about all these things. It's just like when we tell people that, hey, kidney failure is becoming rampant, they don't even understand it, especially when it does not happen around you. So those in the hospital will tell you that literally every week you're having a diagnosis of hepatitis B or C, and those are leading causes of chronic hepatitis. So until you are in that environment before you understand the severity, and that is why I like this year's theme for the World Hepatitis Day. I say, I can't wait. I can't wait to get checked. I can't wait to get tested. I can't wait to take my vaccination. I can't wait to tell somebody that hepatitis is there. I can't wait to stop the stigma around hepatitis. I can't wait for this. And that I can't wait to complete my dose of vaccination. I can't wait to be intentional with sanitation around my environment. I can't wait. And that thing, I think, is so intentional because we need to be more aware that this is there and it is spreading steadily.
Yeah, speaking of which, according to the World Health Organization, the last data they released, they said about 257 million people worldwide are battling with the condition. And you know that we are back to the data issue here in Nigeria. Like Dr. Chinasa said, we do not have accurate data because some people present late and it is not fully isolated. So some people present with hepatitis or liver failure together with some other things. So it is hard to isolate it. So that said, how do you get tested for hepatitis and how do you get the vaccine?
So the vaccination is available for, vaccination is available for hepatitis B and some places may have for A. However, so those are the two that are readily available. You could just you could go talk to your medical practitioner, and usually they run it as a routine test for certain people like pregnant women, for example, or maybe you present with non-specific symptoms. The issue is that things associated with hepatitis, especially in the initial stage, most times the symptoms are non-specific. So that means that it can come with fever, it can come with weakness, it can come with even abdominal pain or not, or it may be there or not. So you see something that is non-specific. So that is why most times people lose, they can't isolate that this is what is going on because the symptoms can be like even malaria symptoms. Yeah. So vaccination is available for A and B. So it's but here, especially in our environment, B is very, very common, very available, and it's in the protocol for the children. It's in their immunization protocol for them. Why for adults, you can get a one-time dose, one-time immunization for 3 doses. There are 3 doses which you take, and it's readily available. So you get tested. If it's negative, then you go for the vaccination. And of course, you have to work with your medical practitioner to recommend that for you. So there's the test to be done. Now, so usually hepatitis A, when it shows with the, there's always that liver derangement when you do a liver function. If I ask, say how many people have done a liver function test? So that's the first thing. When you start seeing something you can see something off there that will raise an alarm that, hey, what is going on? But some people even do the test and sit down and interpret it themselves. They won't even meet a medical professional to help them with interpretation, or to review the test. So those are things that the tests can be done for that. And vaccination for those ones. Then the hepatitis C. It's important to know that hepatitis B and C, they have the potential to cause chronic hepatitis, and even hepatitis C can lead to liver cirrhosis, which is like your liver is almost like dead and gone. Pretty much, that's what that means. So it has that ability to do that. So that is why it's important. As always, it's important. Prevention is important. Getting tested. I can't wait to get tested. That is one thing we should be doing now. I can't wait to check my hepatitis B, which is most common, readily available status. Hepatitis C is also, the test can be done and you check. So the test, you just go to the lab and check the hepatitis screen.
Thank you very, very much. And we'll take the last break, after which we come back and mention the part of lifestyle and prevention, please. We cannot overemphasize the place of herbal medicine. We've not fully talked about that. So when we come back, we talk about it. You're listening to Soul Food here on Smooth 98.1.
Love music. Love life. Smooth 98.1.
If she isn't picking up, calm down. You've not been served breakfast. The biggest reality show in Africa is back, and she's
so we have about 5 minutes after we come back, or maybe
season.
4 minutes.
But last. Pepsi, confirm. Pepsi, for the love of it. Smoother than a fresh jar of soup.
If you love your fresh jar of Skippy, you will love us more because we are smoother than that. This is Smooth 98.1. Love music, love life. It's about hepatitis, your liver, your health, and of course, everything relating to you. My guest is Dr. Chinasa Amadi. My name is Oluwaseun, and you can go to YouTube, youtube.com/smooth 981 FM Lagos. So let us quickly touch on the aspect. Oh, before that, hepatitis. Is it exactly a death sentence?
Thankfully, it's manageable. It can be manageable for a lifetime, depending on how you decide to progress. Yeah, so it's not a death sentence. I think everything is it's all about being aware and start living intentionally.
Okay.
Working with your medical practitioner. So this is not the time to just say, okay, let it be, what we be, or pretend like it's not there. It's important to, and then start, you can, there was let me just quickly go right into the next thing we were supposed to talk about, which is that there was a clinical trial that was done on hepatitis C patients, and it showed that when they were given low fat and low calorie foods, they had a lower risk of steatosis, which is like fat in the liver. Okay. So they had that. So it improved their outcomes. It improved their liver health. And also when they stopped smoking, ceased smoking, so exposing the liver to more toxins were decreased, it improved their liver health. So even those that are infected, they have the potential of improving their health with, safe practices, of course, and stop not doing the things we have talked about before, which are the risk of transmission.
I am not quite sure why people smoke actually, because I have never seen a good or an advantage of smoking. Everything on smoking has to damage your health, your kidneys, your liver, your lungs, everything. So stop smoking, please.
It's so amazing, because that just tells you how the human mind is. I was passing by a tobacco store, and very boldly written on the packs of the cigarette is smoking will kill you. Smoking will they don't even say smokers are liable to die young anymore. No, they actually wrote smoking will kill you. They wrote smoking can affect your fertility. Smoking can affect your sperm count. It's written boldly.
On
I
what
could
you're
see
about
it
to
from,
smoke?
yes, and I could see it from where I was sitting, but the store was full. So what are the people doing there? Excursion? That goes to tell you so we know these things. The question is, are we ready to apply it? And that even comes also with to hepatitis, comes to our overall health. Are we ready to apply healthier self practices to improve our health? That's the question.
And speaking of healthier practices, let's quickly touch on herbal medicines and potions. The truth is, every time I am on the road and I see one person by the roadside saying, quickly give me okpanyi or agbojedi, you see those things that those women are carrying on their head, powder that looks like something that you excavated from the bottom of Third Mainland Bridge. And you just cringe, yet nothing. They still do it. So what is the effect of those things on the liver? And again,
remember what we said, that the liver is the policeman. There's a reason why, for example, English medication, let me call it English medication, there's a reason why it has a particular dose. And your doctor will tell you, take this amount on this particular time at this particular, even something as simple as your paracetamol, taking a lot of it can cause liver toxicity. So it's important that there's a reason why it's 500 milligrams, why it's one tablet, because they've seen that is the amount that will not, it will do what it needs to do, but will not destroy your liver, it will not destroy your kidneys. Now, the thing with herbal concoctions or herbal preparations is that it's pretty much anybody, this is the take one shot. For me, everybody has their own prescription. Every vendor have their own. This one 500 ml of the drink of it will clear this one. If you do it 1 liter, it's just there is no standardization. It's just everybody is doing what they do. So because of that, it's exposing your liver to toxins. something as even the environment can be toxic to your liver. Talk more of something you are ingesting. Something you rub on your skin can be injurious to your liver. Talk more about, ingesting that thing. So it's important to note that this how do I explain that now? The herbal preparation, one has, especially if you even have any form of risk factor, you smoke, for example, or you don't even exercise, or you eat an unhealthy food diet, or you have hypertension, you have some existing condition, you should not be drinking something. It just goes with saying, treat your health as premium. You should if we treat your health as premium, you won't put just anything into your body. And that is something that the health, we need to keep talking about more, especially in this our environment in Nigeria. In this environment, it's important that we are intentional with educating and advocating, constantly advocating that, hey, but it's going to be hard because, we are very traditional. Even the learned people are also drinking. That's the sad part. With the amount of literacy, it's crazy. But
we need to regulate these things more, because if we agree these things can be beneficial, however, the regulation, the dosage, like you mentioned, is the issue. The last question before we wrap up this conversation is from Wilson. Thank you so much for all your compliments, Wilson. And he says that your concerning the intake of alcohol causing liver inflammation, is it when it is taken in excess more often than not, or moderately once in a while? We are back to this alcohol thing. We do love our alcohol.
Yeah, you see, the thing is, I don't like to say once in a while, because the truth is that once in a while for me is different from once in a while for you. I've had a client that his once in a while is just weekends. But the question is, how much are you taking in a weekend? The study showed about 100 gram, which about 100 gram a week or thereabout, like that's pretty much, that puts you at risk in 10, 20 years time. It's not even in 5 years time. You understand? It's in 10, 20 years time that there's this risk for, chronic hepatitis. And you start wondering that, I wish that I made these changes a lot earlier. So it's important that as much as possible, alcohol also has its own other things that it's coming with. It increases your risk for other conditions, which I won't even want to talk about. So there's really no best safe place, for that, especially with certain other conditions. So I think as much as possible, just if you can keep off. It's safer keeping off than consuming one cup.
Thank you so much. It's always a good time with you. Thank you. And thank you. Of course, I look forward to more conversations and more enlightenment. And if you have missed out on this conversation, you can go back to our YouTube channel. As usual, we save the video for you. Just search for Soul Food 981, things to note on hepatitis. That's what you're looking for. Share it with somebody and they will be thankful. I will also put it up on our WhatsApp status. My guest has been Dr. Chinasa Amadi. She's a lifestyle medicine physician and the founder of Ariela Health Fitness. You can check her on social media. That will be Instagram and, of course, Twitter. Again, thank you and thank you.
Thank you so much for having me.
Bye. Next up, the kids will come around. It will be a great time. And it is Curious Mind from 8:40 till 8:55. Tell your kids between 6 to 15. Let them come around and have a great time. What don't we talk about? We do not talk about Bruno.
And what he saw. Then you better figure it out because it was coming for you.
Thank you so much. We don't talk about Bruno.